So you want to know if drinking too much water can hurt you. Well, in this video, you're going to learn all about drinking water and whether or not too much of it can hurt you. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your healthcare needs. By the way, if this is your first time on the channel and you like to get fact-based healthcare information, go ahead and subscribe below. Also, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the information and the disclaimer are in the description below. So before we get into it, what's the purpose of drinking water? So there are many benefits of water intake. Water is needed in the body to assist with efficient blood flow, to maintain blood pressure, help regulate body temperature, help bowel, kidney, and lung function, and protect cells and tissues and skin from dehydration. As well, it cushions the brain and provides numerous other benefits. So how does the body regulate the need for water? Water intake is regulated by powerful thirst mechanisms. You need to be able to intake water, you need to be alert, you need to be able to access water, to drink and swallow water. The sensation of thirst is aided by powerful forces such as osmoreceptors in the hypothalamus, as well as the antidiuretic hormone from the pituitary, which works on the kidneys to reabsorb water from the urine as needed. So if you're able to source water, how much is enough? There is no magic number, and it's all dependent on your level of thirst. Basically, you need to pay attention to your body signals. It's all about the level of thirst. If you've had enough, you won't feel thirsty, your mouth and lips will not be dry, your urine will be clear. And it's important to underscore here that most fluids are okay. You don't need to be restricted to just plain water. As well, there are many fruits and vegetables that contain considerable amounts of water, so that helps also. And the claim that everybody should drink at least 8 glasses of water per day is an absolute myth, as there is no irrefutable and reproducible scientific evidence to support that claim. The body is very clever and easily regulates hydration by way of powerful thirst mechanisms, so you don't have to drink a certain number of glasses of water or be told to drink a certain number of glasses of water in order to stay hydrated. So how much water is too much? And what are the symptoms of water intoxication? Here's a list of some of the symptoms that are associated with excessive water drinking, overhydration, or water intoxication. Lack of thirst, nausea, headaches, confusion, lethargy, fatigue, and cramps. These symptoms may range from mild to severe or making someone comatose. The cause of these symptoms is hyponatremia or low blood sodium levels. Very low blood sodium levels can lead to coma or death. So who's at risk from drinking too much water? So those at risk from drinking too much water are folks that are misguided, those that have mental issues such as psychogenic polydipsia, those that have kidney or liver problems or heart failure, certain medications such as antidepressants, antidiuretics, and hallucinogens can trigger water intoxication. Endurance athletes are prone to water toxicity, as well as those with mental health decline and Alzheimer's. Also, there are some rare disorders such as inappropriate antidiuretic hormone secretion. So how can water overhydration or water intoxication be prevented? So the most important way to prevent overhydration and water intoxication is to use common sense and respond to your thirst levels and drink accordingly. Don't be drinking when not thirsty, and respond to body signals such as urinary frequency and the color of your urine. By responding to your thirst levels, it is unlikely that you will ever be dehydrated or overhydrated. There is no magic number of glasses of water. that people have to drink to stay hydrated, as the body's thirst mechanisms are very powerful regulatory forces. So how is water intoxication diagnosed? Water intoxication is diagnosed through clinical evaluation. The patient may seem lethargic and confused, complain of headaches and nausea, and a blood test will show low sodium levels, and the urine test will show a low specific gravity. So what are the complications of water toxicity if it's untreated? So the potential complications of untreated water intoxication include brain swelling, confusion, delirium, seizures, and rarely death. Most, if not all, of these symptoms can be prevented by responding to your thirst mechanisms appropriately. So how is overhydration or water intoxication treated? Most people do not need hospitalization and can be treated by just restricting water intake as an outpatient. If symptoms are severe, the patient may need hospitalization, monitoring, and treatment. Such treatments as hypertonic saline and other medications such as vasopressin antagonists and/or mannitol. Some may also need behavioral modification after treatment for water intoxication. So let's recap in this video about, can too much water intake hurt me? You learned that too much of a good thing can be bad, that there are powerful thirst mechanisms that regulate water intake, and that over-drinking and water intoxication can lead to serious health risks. To learn more about other medical conditions, self-care, and digital health, check out these other videos.